All right. Hello, everyone. Good day to you, and welcome to Functional Medicine for Real World Impact. I'm your host, Tracy Harrison, and today we're going to be diving into nitric oxide nuances that practitioners need to know. Nitric oxide is one of those subjects where many practitioners know enough to be dangerous. We know that nitric oxide lowers blood pressure. We know that healthy foods like beets help us to make nitric oxide. We know that certain amino acids, I think it's arginine, helps us to make nitric oxide. But often our knowledge doesn't go beyond that. And the clinical power around nitric oxide lies in some of the nuances. While it is indeed a standalone root cause of hypertension, challenges with nitric oxide are usually a downstream consequence of a system that has lost resilience. Today, I'm going to be sharing 6 important nitric oxide nuances that many practitioners simply haven't yet connected. First, let's start with a brief overview. You're likely aware that nitric oxide is critical for vascular wellness. In truth, it may be one of the most important biochemicals that you've never thought very much about. This tiny gaseous molecule is a master signaling molecule, and it does indeed help to coordinate vascular health, but it also is heavily involved in a rich diversity of functional balances, including cellular energy production, immune regulation, brain function, tissue repair, and more. When nitric oxide production declines, the effects can actually show up almost anywhere in the body and often years before other overt disease occurs. And today I'm going to be walking you through some of the common signs, first of all, that might point to impaired nitric oxide signaling and why it matters. First of all, there's hypertension. And you're likely already familiar with this one, right? Hypertension or loss of healthy blood pressure regulation can indeed be as a result of inadequate nitric oxide. This molecule is produced heavily in the endothelial lining of our blood vessels, and it diffuses into endothelial cells, into the smooth muscle that surrounds our blood vessels, where it causes those muscles to relax. This allows the vessel to widen, causing vasodilation and increases blood flow while also reducing vascular resistance and blood pressure. But early hypertension is just one of some of the early cues and clues you can look for nitric oxide challenges. Another one is impaired exercise tolerance or reduced endurance. This makes sense in terms of our cardiovascular system's ability to accommodate aerobic exercise and to have quick recovery. So we can look for that symptom. This might also be a reason for cold hands and feet. Now, we know that that might also be something like hypothyroidism, especially if there's full body coldness. It might be some type of anemia for poor oxygenation, circulation of oxygen. But inadequate nitric oxide might also be the devil in the detail that is promoting those cold extremities and impaired peripheral circulation. The third cue or clue I encourage you, sorry, the fourth cue or clue I encourage you to look for is cognitive impairment, that pesky brain fog, poor memory, poor concentration. Again, there are many possible drivers for this. We know, we've seen, for example, in our practices with long COVID or other long standing viral illness, that damage to our nerves might be part of what is at play in, cognitive impairment. But of course, we need good vascular function in the brain. And so we want to think about where challenges with mental functioning or neural functioning might actually have to do more with vascular dysfunction than neural dysfunction. And then the fifth of five early signs to look for impaired nitric oxide is for men, erectile dysfunction. The penis is remarkably sensitive to and dependent on bolus nitric oxide support to enable an erection. And so when men begin to struggle with erectile dysfunction, even in the early stages, it could be a key clinical cue for you that nitric oxide would be an important focus. In women, while there is no tissue that is so dependent on that type of bolus nitric oxide production, reduced lubrication, vaginal lubrication, and perhaps reduce arousal and responsiveness for women sexually could also be a sign. We obviously need good vascular circulation in order to promote tissue response to sexual arousal. So, the second thing I want to share with you is how do we produce nitric oxide? One of the challenges with limiting our clinical focus for nitric oxide to focusing on arginine, which is important, it is an essential amino acid, is that that is not the only key cofactor. And the path that arginine uses is not the only way we can make nitric oxide. We actually have two ways of synthesizing it. The first is called the eNOS pathway. eNOS is a four letter acronym, ENOS, which stands for endothelial nitric oxide synthase. This is an enzyme that is prolific, especially in our blood vessels, and bringing together the combination of, yes, arginine, but also ample oxygen, as well as tetrahydrobiopterin or BH4. This combination of cofactors uses the eNOS enzyme in order to make nitric oxide. And of course, this pathway is very dependent on sufficient levels of the enzyme, and we can indeed have genetic impairment in that. And of course, we need a level of endothelial health to make eNOS in order to keep that endothelial lining healthy. I'm going to come back and talk more about tetrahydrobiopterin in just a moment, because that is often, much more often, what's missing from the recipe to synthesize nitric oxide than issues perhaps with arginine. But this eNOS pathway is just one way that we can make nitric oxide. The other one is a more traditional nitrate pathway. And this is where dietary nitrate from foods such as beets and arugula and spinach can in the body be converted to nitrite and then taken up in use to synthesize nitric oxide. This is an area where diet also can contribute dramatically to our ability to produce nitric oxide. And of course, using nitrate forms of nutrients or as supplements, such as potassium nitrate, can indeed help to ensure sufficiency of cofactors. But we have two different pathways that we can support. And it's actually important that our diet, our lifestyle choices supports both. And this leads me to nitric oxide truth number three. The reality is that nitric oxide deficiency is not often just an overt deficiency, a challenge with synthesis. It is important that we consider how much age in particular does lower our ability on average to produce optimal levels of nitric oxide. For most of us, there's a fairly linear reduction in nitric oxide synthesis as we age, beginning in our 30s. But many practitioners are focused for their patients who struggle with this, especially with hypertension. They focus on how do I just make more nitric oxide? And so this often leads to dietary choices, supplement choices, which is important. But for many of your patients, the bigger issue, the better question is not how do I make more nitric oxide, but more, why am I losing so much of it? Why is so much of it being consumed in this person's physiology at this time. And this is where, of course, the functional medicine lens always compels us to go upstream and look at what are the root causes and mediators of antioxidant insufficiency. And this is where your patients and clients who have, for example, sleep apnea, right? Dramatically impaired oxygenation. Of course, they're going to struggle to make optimal nitric oxide with impaired oxygenation for a big chunk of the night. And then on top of that, the oxidative stress that is generated during those episodes puts an additional burden on our nitric oxide. Your patients who have hyperglycemia from diabetes, or even if they have hyperinsulinemia and an awful lot of early onset hypertension is happening during times of hyperinsulinemia, right? When blood sugar isn't necessarily high at all, but compensatory pancreatic production of insulin to handle our high glycemic lifestyle is setting us up for insulin resistance. Pretty much all stages of metabolic disease are going to create excess oxidative stress and put a heavy burden on nitric oxide destruction. So even if we're copious producers, it's being heavily used. Toxicity, another important area of investigation. When we have higher levels of circulating toxins because of chemical additives in our food, in our water, in our air, in our personal hygiene and beauty products, in our household products, textiles. We're living in a chemical soup these days. And indeed, this is an area in which damage to the endothelial lining of our blood vessels, especially that precious glycocalyx in the lining, in the endothelial lining, can be injured. And this, of course, not only impairs nitric oxide synthesis, but it also increases use of nitric oxide to counter the damage. And so it's important in your clinical priorities for individuals who are struggling with suboptimal nitric oxide to not just think about how do I make more, but to go upstream and try to identify market sources of oxidative stress and damage that step by step we need to partner with a unique patient to remove from their day to day lifestyle habits and circumstances. And another key component of how nitric oxide is lost really might surprise you. And I really encourage you to pay attention here. The eNOS enzyme, that endothelial nitric oxide synthase that I mentioned earlier, is an enzyme responsible for producing nitric oxide ideally. But like a number of other enzymes and some important biochemicals in the body, it can become uncoupled. And when that happens, this enzyme stops generating nitric oxide efficiently and instead begins producing free radicals. And so I'm sure, as you can see, this becomes a double negative. Not only is less nitric oxide being generated for healthy vascular signaling, but the uncoupled enzyme is actually generating more oxidative stress that further impairs endothelial function. And so normally enos, like I said, is using arginine and oxygen and electrons and tetrahydrobiopterin. We are synthesizing nitric oxide. But what happens when enos becomes uncoupled is it starts to produce superoxide. So now the same enzyme that should be protecting the vasculature is actually contributing to the oxidative stress. It's actually a similar gotcha and a double whammy for what happens when our HDL, our high density lipoprotein levels, get too high. HDL can actually lose the very function that has earned it the name good cholesterol, where HDL can lose its reverse cholesterol transport function, and it is no longer able to rescue us from oxidized LDL and helping to minimize atherosclerotic progression. So, HDL, when it's excessive and overstressed by oxidative damage, can go from becoming something very positive to a double negative. Well, the same thing can happen for enos. And this is where you may see patients whose symptoms don't respond to nitric oxide supportive interventions, especially if it's about adding more nutrients, adding more cofactors, changing the diet, right? Trying to drive greater production. If enos as an enzyme loses its good guy status and actually starts working counterproductively, patients are likely not to respond. They will become resistant to your interventions to increase nitric oxide. And so, this is something to keep in mind and points even more to the importance of going upstream and addressing sources of chronic inflammation, which is often in the gut, chronic oxidative stress and damage, which is often from metabolic disease, especially under recognized early stages of metabolic disease, and from toxicity. There's certainly many other drivers, right? Simmering infectious challenges can be at play too. But we need to go upstream and look at what is actually promoting the chronic inflammation or the chronic oxidative stress and damage that as it progresses, will cause the enos enzyme to become decoupled. It also speaks to why we don't just want to be supporting the enos pathway, but we also want to be supporting the nitrate pathway. And for these particular patients, doing the best we can to partner with them to define sustainable opportunities to increase healthy nitrate in their diet. The fourth item I want to share with you today is actually going back to the powerful biochemical tetrahydrobiopterin, BH4. This is one that practitioners often don't emphasize. Again, so much of the focus on nitric oxide is about arginine or even citrulline. But as I shared earlier, the recipe by which enos is able to make nitric oxide requires BH4. And it can be an overt or insufficiency of BH4 can overtly block synthesis of nitric oxide. And having good synthesis, but also regeneration, recycling, if you will, of BH4 requires some key nutrients that we don't often associate specifically with nitric oxide. The first of these is folate, preferably either in the form of food, assuming an individual has good digestion and absorption of their nutrients in the gut, or if we're going to use in a supplement, then we would really like to focus on the methylated, just upstream precursor to folate, 5 methyl tetrahydrofolate, right? 5 MTHF. But folate is essential, and many of your patients and clients are not taking in what they need in their diet in order to optimally support nitric oxide. BH4 also requires vitamin C and it also requires magnesium. These are common focus areas in functional nutritional support, but we don't often associate them specifically with tetrahydrobiopterin or with nitric oxide. So be sure to keep these key cofactor nutrients in mind and don't miss out on BH4 as a critical cofactor for nitric oxide. The fifth nuance that I want to talk about is actually um, our partners in generating nitric oxide because our human tissue doesn't actually make all of our nitric oxide. There is indeed another pathway, and this is courtesy of our microbiome, but primarily not in the lower part of the gut, but actually the top of the gut in the mouth. And a number of different species of bacteria in the mouth can use nitrate to produce nitrite and to synthesize nitric oxide. This means that if we want to have optimal nitric oxide synthesis, we need to start considering dental health and the health of the oral microbiome in our clinical plans. We always want to be asking patients and clients about their oral hygiene, about their overall dental health. And in particular, you might be surprised to learn that research has shown that products that overtly kill off oral bacteria can dramatically limit our nitric oxide synthesis and can overtly contribute to hypertension. It's a way in which disease can begin in the mouth or at the top of the gut that many practitioners don't consider. This means that any type of product that your patients use that kills uh, microbes in the mouth could potentially be a problem. This can be, in particular, alcohol containing mouthwash, but even natural mouthwashes that include strong antimicrobial herbs can be part of the problem, right? This could be an issue with using even stronger products like chlorhexidine. There may also be an issue with the thriving of the bacteria in the mouth and thriving in this nitrate reduction in order to produce nitric oxide. And this has to do with dry mouth. Individuals in your practice who have Sjogren's, women who have low estrogen, potentially hypothyroidism, dynamics that might be contributing to dry mouth may actually impair the health and vitality of our oral microbiome. So it is a concept that it's important to integrate into our clinical plans. And while we certainly might refer to other practitioners in the dental industry in order to support dysbiosis, an overt infection in the mouth that needs to be treated, we can certainly provide good targeted education and guidance to patients around helping their oral microbiome to thrive. Certainly, part of this is also avoiding chemicals in our food, chewing our food very thoroughly so that we can mobilize and activate more of the nitrate that is in it for optimal nitric oxide synthesis. And the sixth point that I want to cover today is actually about thinking beyond the blood vessels, because nitric oxide is not just a vascular story, it's not just a blood vessel story. It also is essential in our mitochondria and is potent as a nervous system regulator with neurotransmitter like effects. First of all, nitric oxide does play a regulatory role in mitochondrial function, including ATP synthesis, oxygen utilization, and therefore the energy, the cellular energy that we are producing. Your patients who struggle with mitochondrial dysfunction, who have inexplicable fatigue and poor recovery, this may indeed be as a result of inadequate nitric oxide. So while we're focusing on other aspects of cellular respiration, of making sure there's enough vitamins B2 and B1 and B3 and B6. And we want to make sure that we're getting good macronutrients from our diet, that we're countering insulin resistance to enable carbohydrates to be used for fuel, that we're getting plenty of carnitine in our bodies to enable us to use fats for fuel. Keep in mind that nitric oxide is also essential for regulating mitochondria. And not surprisingly, because our nerves are so rich with mitochondria, nitric oxide is also essential for brain health and function. Nitric oxide can play a powerful role in things such as autonomic regulation, vagal nerve transmission, overall cerebral blood flow, neuroplasticity. I already mentioned memory and recall. And so this means that nitric oxide could be an often overlooked factor in your patient cases who are wrestling with anxiety, mild cognitive impairment, trouble with sleep that might have its roots in neurotransmitters, or any state of neurodegeneration. So, we just want to keep in mind that nitric oxide is a powerful signaling molecule whose effects are essential for vascular health, especially in our arteries, but throughout the entire vascular system. But its impact does expand throughout the body, given its powerful role as a signaling molecule. So, um, we want to keep in mind, in summary, that nitric oxide needs to be part of our clinical inquiry, part of our clinical focus, and that the question isn't always about how much nitric oxide is being made, it's also about what's happening to it after it's being made, right? Are we depleting it? Are we creating a double negative? In short, our nitric oxide sufficiency is really setting us up to have systemic resilience. It's not just about blood pressure; it's about adaptability for having healthy insulin signaling, healthy neurotransmission, healthy microbiome, a healthy endothelium. And so, in summary, I encourage you to think about nitric oxide in all of your clinical cases, that it's not just a molecule to boost, it's a physiological capability to protect. And everything we focus on in going upstream and identifying common sources of oxidative stress and damage is going to be powerful in protecting nitric oxide. In particular, I'll summarize again: metabolic dysfunction, especially the early stages when blood sugar may still be optimal, even subclinical hyperinsulinemia, hence, even subclinical hyperinsulinemia can be a culprit. Number two, poor oxygenation, anemia, sleep apnea. Any type of oxygen deprivation can be a culprit for impairing nitric oxide. Number three, toxicity. What toxins might be in regular day over day habitual use that are contributing to oxidative stress and damage of our endothelial lining and impairing our ability to produce nitric oxide? And then we want to cast a broad net and think about other factors that might be in play, including viral overload, and other types of infectious imbalances. At the end of the day, oxidative overload, right? Chronic oxidative stress that perpetuates oxidative damage is the major driver of chronic inflammation in the body. And protecting nitric oxide so that it can protect us is a critical reason to focus on identifying and removing drivers of oxidative stress. Thank you so much for joining me. I look forward to seeing you next time.